Gover, and the wonderful program that you and DR and others have put up. I wish to let you know my financial disclosure as a grant I received for my research work. The topic is practice, teaching, and publishing in peer-reviewed journals. Practice, I mean all kinds of practice, the medical college, the charity, the government, the dean, or private solo group, whatever, it doesn't matter. But for me, it's a private practice, as some of you know. But I think it's relevant and anybody can tune in that regard in the practice. I think whatever form of you are involved in a practice, we have recognized the value of the management of that practice and all the other modern concepts of health care and eye care very well. But the fundamental thing remains that you need to be competent, and that is so fundamental, it's so elementary, as Sherlock Holmes used to tell Dr. Watson. It's really, truly very elementary that you be competent. And I'm a teacher, but those who can, does, and gets on going. But like me, who cannot, just keeps teaching. So here I am, telling you what you can do, although I can't do most of the things myself. Teaching is something also, I think there are many aspects of teaching, and all of you have learned from many people sitting here, and I can, if I had to give one name, it's Dr. Nakpal, I would give that. Teaching and passing on the knowledge and sharing actually enriches yourself not only as an educator, but also as a human being, and you can translate into your whatever actions you're doing, including the care you give to the patients. And to me, I've enjoyed what is known as fellowship program, but it's the same thing. Whatever form you're in or whatever name you give to your juniors or students, that kind of program is the most rewarding for individual person, the teacher, but also for students, the hospital family, the patient, the society at large, and it really does a great good. And can you do that in practice, in private practice? That's the main thing. How come you do that? And IIMA Ahmedabad took our case, our organization, as a case study and put it in their curriculum for 3 years. How come in a private practice you can do what is written as a title as a successful practitioner in a private or publications or academicians or researchers? So I think you can do that. And I'm not the only one. I have followed and duplicated many other solvers. So I think doesn't matter what form of practice you are, as long as you remain a competent clinician and you want to be a teacher, a basic instinct. And you can do all kinds of teaching. Clinical teaching is something most are very good at it. You can also perform wet lab and methodical step-by-step surgical teaching through all forms of patients and wet labs. And also you can have a mutual didactic or interactive sessions or this is my coffee time. I have a coffee time at 11:30 for 20 minutes, and we have that kind of thing in our cellar. Sometimes they ask the questions and so on. So I think teaching is the fundamental thing. The challenges are obviously many, but it takes up a lot of time, and if you're a full-time person in a very heavily overstaffed hospital, and I don't see any in India, but there are quite a few all over the world, you have plenty of time, and that may not be an issue, but to most of us here, time is an issue, and it does take up a time, teaching and whatever else is listed in this title. And there is no apparent gain. My own family members and my old well-wishers, friend, Abhaya, what are you doing all this? For what? I mean, crazy? And the worst part is that until you prove yourself by your delivery of the good quality, they're saying this is experimentation. We are used as guinea pigs, and I see many junior doctors around Dr. Vasavada. Are you really operating? I've heard the story. You never do that. So you have a question of survival in a society where you are trying to do these things. So. But it's possible if you are committed and if you're convinced about that need. Is there a need? Well, I think to me as an individual there is of course a need, because I want to keep improving myself every time until until my last breath. But in real terms, if you can acquire the knowledge all along through whatever kind of research, the clinical research, the basic research, the translational research, whatever, and you can, it's without your knowledge, you can apply it to clinical practice. Even you will not realize that you're doing that. You can actually put it in your practice without knowledge, and in generally you will do a greater good to the science, to your family, yourself, your accountants, and everybody else. So I think even if you're a business person or an organization, and one of the pillar stones for organizational development, be it medical or otherwise, is a concomitant R&D activities, as we heard from these industries, and also practice. So we can have the same thing in our own individual or whatever form of practice you are. And it's very vital, and never vital before than ever, that you do both of these for continuous sustained growth of the organization and the clinical practice. Well, the first requirement or necessity to do that is obviously you must have instinct. You must have some kind of a mutation in one of those chromosomes, that you must have a desire to know yourself. So if you have that, it's easy, but you don't have to necessarily have that genetic acquired by mechanical environment you are trained with or you see around. So if you do not have, I never had that. When I was in England, I thought I'm a surgeon. I have nothing to do. I'm a technician. But if you're exposed to environment, and if you're a good director, if you're good friends, and you can develop that also. It doesn't have to be truly genetic. But the second requirement, I think it's good for everything in practice management or whatever priorities you have in your organization or practice, is to create a team. And it is a team which is really doing the job. You may be a leader for a while, but it's a team, and that keeps on changing. The third is the patience and resilience. Because it's going to take a time, you need to have some kind of long-term vision and tolerance, and have a bigger pitch rather than a short-term gains. And finally, I think discipline is the word for everything. Everything you do and behave, and to use yourself or to other fellow human being. And the prerequisites for a research or publication, this is a little bit about details for some of those who are interested. Identify clinical problem. What bothers you when you see patient after patient with the same symptom or same complication or same response to an intervention? Identify that problem and then acquire the knowledge about it. And you can do that when you separate out your business scheduling. The scheduling is a word for management. You must have your scheduling not only for yourself, to given to your secretary and all other people in the management. They know separate hours, separate funds, research activities, and then train yourself to be a second investigator and then the primary investigator, and ensure that you are established in a practice. First is establish yourself. I did 5 years of struggle reading Times of India because I settled in a city, nobody knew me. And once I established, then these things happen. So establish a flow of patients, and then you can acquire all kinds of resources. But finally, I think it is this that is the easiest part of us. The basic research, you need true PhDs and access to the institution. Clinical research need training, and really good training and good institution. But finally, the translation research, making sense of that clinical problem or observations you have taken with the help of applied research or a basic research, is something I'm getting interested in. So I think I understand this. So thank you so much.